This is Adam Kokesh, and I'm here in front of the White House on May 1st, 2012 at May Day with Jonathan Hutto. Jonathan, tell us who you're here representing and what you're doing today.
Well, I'm here with the People's Coalition for Police Accountability out in Prince George's County, Maryland. So we come from a coalition that's worked against police brutality for a number of years. We were first sparked back in 1999 with the murder of Prince Jones, Archie L., a number of other African-American males primarily. But of course, we see that struggle as connected to the struggle for all people, particularly the working class, who have been struggling on a number of issues, and the Occupy movement, of course, being the moral issue of our time. So we want to bring voice to that movement and bring power to that movement.
Well, there's definitely a connection there. We see police brutality by government agencies that aren't at all accountable to the people. What exactly is that connection when we have police that are able to do such heinous crimes and violating individuals' rights, and then on a large scale we have a government that creates large-scale economic violations?
Well, the police, as we were taught in school, were supposed to be officer friendly. You know, this is the guy you call when you're in trouble and they help you out. And I've had, individual police officers to help me out. But as an institution, they serve to protect the state and to protect the actual function of the state. And so whenever you have that, and whenever it's profit, whenever you can make profit off warehousing people, I mean, that's essentially what it is. I mean, you got massive private prisons being built in this country making profit off labor that used to be done.
Well, now you sound like a libertarian free marketeer wanting to make sure that the government gets out of providing for the public safety, and instead we don't have a monopoly on that from government. We would have competition for providing for the public safety from different agencies. Is that really what you're advocating?
No, I wouldn't say I'm a libertarian free market. Say it again, libertarian free market what?
Free marketeer.
No, I'm going to say I'm a libertarian free marketeer, although I can find common ground with libertarians on some issues, particularly in the foreign policy arena. But in the domestic arena, I want to live in a society where, folks, healthcare is a human right. Education is a human right. In other words, if it's good enough for Obama's kids, to get a world-class education, everyone should have access to a world-class education. But if everyone can't have it, we should just shut the system down totally.
Well, when you say you have a right, like, to something tangible, like an education, or a service that's being provided, like you're advocating in healthcare, aren't you saying that people have a right then to use the government to have a monopoly over the distribution of those services, like they do over law enforcement and providing for the public safety, in a way that inevitably says we're going to do violence or we're going to threaten force against people if they don't respect these positive rights, that like by creating a right to something that someone else produces, you're saying that you then have a right to use the government to force them to provide you with a good or a service?
No, essentially what I'm saying, Adam, is that if we're going to have government, it should be an extension of the people and vice versa.
So if we're going to do violence, if we're going to force people to do certain things, that we should have a broad consensus on it, like in a democracy.
Exactly.
So you're saying that if 51% of the people in a country vote for something, they can force their will on the minority, the 49%?
No. The rights of the minority should always be respected in principle.
So does a doctor in your system, where people have a right to health care, have a right to be left alone by government that should be respected and only treat patients that he chooses to treat?
Ask that question again.
In the system that you're advocating, does an individual doctor, does his right include the right to be left alone by government that thinks that because 51% of the people voted that health care is a right, that they should have the ability to force that doctor to see patients as opposed to letting him choose who he would see and who he would treat for himself?
Well, I would hope that if you're a doctor, you've taken the Hippocratic Oath, that if anyone comes to you sick, that you would see them.
Well, that's kind of avoiding the question, though. When you're saying that health care is a right, that people have a right to health care, you're saying that government is essentially going to come in and have to force doctors to provide care for certain people, because otherwise there wouldn't be the need for government at all in your system.
No, that's not what I'm saying. I didn't say it at all. What I said is that people have a right to health care.
Well, okay, if that, then how is it provided for in your ideal system?
In my ideal system, if you're sick, you go to the hospital and you get help. Because the hospital is an extension of the government. The government is all the people.
Well, wait, so the government should have a monopoly on health care like they have a monopoly on the police force?
Why do you keep bringing No. The police force is not monopolized by the government. You have separate local police forces, state police forces. You have national police forces that all actually answer to the entities where they are, whether that's local, county, state, federal, what have you. So I don't believe it's a government monopoly on police forces.
But all of those are government agencies that provide public service of public safety, right? So that is a monopoly because they don't let anybody else engage in enforcing laws.
That's what they say they provide, but in actuality, they protect the profit interests of the country.
Oh, okay.
That's what police do. Police guard the banks. Police protect metro stations. Police protect the White House, for example.
Right.
Police protect the Capitol. They protect all of that, which is considered monetary interest.
Right. And you said that in your system, hospitals are extensions of government. So why would it be any different that the system that you're advocating, why would it be different when the government then has a monopoly? If the government owns the hospitals, if the government has a monopoly on providing health care, why would it not be prone to the same problems of lack of accountability that we have in law enforcement that you're fighting against?
Because the basis of why the system runs, and this system is based on profit. We want a system that's based on people.
You don't think the law enforcement system of exploitation of police brutality is based on profit by government? As you said, it is.
It is based on, yes, it is. It's based on profit. Yes, it is. It's based on protecting the monetary interest. It is, as it currently stands in this country. Yes.
So the system you're advocating, healthcare, would be prone to the exact same problems as the current system that we have for providing public safety and law enforcement, would it not?
No. See, what you're presupposing is that I'm talking about a radical overthrow of the system that we're in. I'm not saying that. I'm not saying a radical.
I'm not suggesting that.
Oh no, well, your thesis that I'm getting from this, I could be wrong, is that I want a totally alternative system. What I'm talking about is a radical reform within the actual system that we're in.
Well, the system that we have today, I mean, is already pretty close to what you're advocating. The government mandates provision of health.
What do you advocate, Adam?
I'm advocating.
What do you advocate?
Keep the camera. Keep the camera.
What are you at? No, keep the camera rolling, because now I want to know what you're advocating. All your questions come from a certain place and base. What are you advocating?
I'm advocating for the end of all violence and initiation of force against people that are acting peacefully. And as you point out, the system of law enforcement that we have in this country, where police are able to get away with such brutality because they're protected by government, because they have a monopoly, because they're a violent gang that impose their wills on certain populations because society grants them that monopoly on policing, is the same thing that you're suggesting with government-run healthcare. When you say healthcare is a right, it's basically saying, in the same sense, that public safety is a right. Therefore, we're going to have a government system come in that's going to have a monopoly on providing those services, and it's going to be prone to the exact same problems for the exact same reasons, and that is that it's based on initiation of force against people who are acting peacefully, either in how it's carried out and how you mandate that doctors treat certain patients, or how you pay for it, because taxation is violence. Taking money from people at the barrel of a gun at the threat of force by government, no matter what the excuse, is just another form of violence.
We're going to get together and talk about this one, Adam. I like this guy.
Jonathan Hutto is giving up that quick. Down for the count. Jonathan Hutto.
I got to get ready to go home and make sure my son does his homework. No. Me and this guy got to get together.
Is that what happens when confronted with the violence of the system?
No, because this conversation will go longer than this interview. but
it's okay. I think for the internet libertarians watching this,
these are libertarians?
Your point was made. Thanks, man.
Ground on the war, definitely. I know you were a libertarian.
Yeah, anarcho-capitalist.
Oh, where? Oh, okay. Yeah. I'm very familiar. He's wild.